Good day, everyone. Welcome to module 14C. And this module will be discussing assisting with self-administration of medication. Assisting with self-administration of medication. Without wasting much time, we'll move quickly to what medication really is. And in the picture, we see a hand with medication and a hand giving water. So as home health aides, in most cases or oftentimes, our patients don't, people generally who don't like taking drugs. So we have to intentionally assist. And this assistance is just not, it is not only just to give them water to take drugs, it's to help them, or will I say, enforce them as necessary, or encourage them to take what their medications. So the assistance of self-administration of medications by home health aid is not allowed in every state or country. So you should be specifically trained and assigned to provide assistance with medications. Personal care aides are not allowed to assist with administration of medication under any circumstances. Now, assisting with self-administration of medication is different than administering the medication. Only licensed providers such as physicians, nurse practitioners, registered nurses, and the licensed practical nurses may administer medications to patients. Now, a home health aide may assist patients with self-administration of medication, but personal care aides must never assist with medications in any way. Here comes the distinction between two. Home health aides may assist, whereas personal care aides must never assist with medications in any way. So assisting with medications means that the home health aide may remind patients about taking their medications, bringing the medications to the patient, and bring other equipment needed to take the medication, such as probably an inhaler to the patient. Now, the home health aide may bring liquids such as water to the patient so that they can take their medication. Then the home health aide should also assist the patient into the correct position so the patient may take their medicine and not choke. No. For example, the medications taken by mouth, for medications taken by mouth, patient should be in a fully upright position. And this helps to prevent choking and also allows the medication to move down the esophagus into the stomach. So medication should never be crushed unless the care plan specifically states. So remember to always keep medication stored in a locked area. Remember to always keep your medication stored in a locked area. If the home health aide notices a patient taking the medication incorrectly, or if the patient has a reaction to a medication that was taken, the home health aide should inform their supervisor. Now, medications are dropped or mixed with other medications. So, if the medications are dropped or mixed up with other medications, the home health aide should inform the supervisor. If the home health aide becomes aware of herbs, supplements, and medications that the patient is taking, which they have not told the healthcare team about, they should also inform the supervisor, because this could endanger the patient's life if peradventure there is an adverse reaction or when not necessarily when the patient is taking what was not prescribed, it exposes the patient to a lot of risks. So you should inform your supervisor immediately. Now, home health aides may also show the patients the medications and then read the label to the patient so that the right patient, the right medication, the right dose, the right time, and the right route may be checked. Now, all these are the the five rights of a patient. The right patient should take the medication, taking it in the to take the right medication in the right dosage at the right time and following the right route. So all this should be checked. And understanding the following, the five rights of the medication helps to avoid medication errors. So we can keep these five rights of medication, which are the right patient, the right medication, the right dose, the right time, and the right route. This is very, very hard to make errors when we follow the right this five rights of medications. If the home health aides ever have a concern about any of these rights, they should speak to their supervisors immediately. Now, the safety and well-being of the patient depends on what the home health aide. The negligence of a home health aide can kill a patient. So, what is the procedure or how? There's a procedure for checking the right person. Checking the right person, that's the right patient. First thing you do is to wash your hands, read the container label on the medication bottle, check the name on the label to make sure it is the same as the patient's name, check the name on the label against the name on the care plan and against the patient's ID band if they are wearing one. If the patient can respond, ask them to tell you what their name is. And if the patient's name is the same as what is written on the label, you can proceed to hand the bottle to the patient and or you can assist with the administration as trained and ordered on the care plan. So, but if the names are not the same, stop. Do not proceed further. If the names are not the same, you contact your supervisor for further instructions. Then you explain the reason to this patient because patient safety is the number one priority. So if medication bottle does not have the patient's correct name, this puts the patient in danger of taking someone else's medication. Then you record and report any problem about the medication in question to a supervisor. Now, how do you check for the right medication? How do you check for the right medication? Now, checking for the right medication means that you are ascertaining what drug the patient is taking. So, wash your hands, read the container label on the medication bottle, read the container label on the medication bottle, check the expiration date on the medication bottle, check the name of the medication on the label to make sure it is the same as the medication listed or listed on the care plan. Now, if they are the same, you can proceed to hand the bottle to the patient and or assist with administration as trained and ordered on the care plan. If they are not the same or if the medication has expired, you do not give, you stop, do not proceed further. Contact your supervisor for further instructions. They can explain the reason to these patients because patient safety comes first. That is the first or the number one priority. If the medication bottle does not have the patient's correct name, this puts the patient in danger of taking someone else's medication. So record and report any problem about the medication in question to your supervisor. And the next thing in line is how to check for the right dose. Checking for the right dose, of course, we wash our hands, read the container label on the prescription bottle, on the medication bottle, then you check the dose on the label against the dose that the patient listed on the organization that is listed on the care plan. If they are the same, proceed to hand the bottle to the patient and or assist with the administration as trained or ordered to. But if they are not the same, stop. Do not proceed further. Contact the supervisor for further instructions and explain the reasons for this to the patient. Incorrect dose information could lead to what? Patient taking too much or too less. That's not enough of the medication. So you record and report any problem about the medication in question to your supervisor. Then checking for the right time. Checking the right time. Of course, we've washed our hands, read the container label on the medication bottle. Then now you check the time for taking the medication listed in the bottle against the time specified in the care plan. If they are the same, then you can proceed with the administration or assist with the administration as trained and ordered by the care plan. But if they are not the same, you stop, do not proceed further. You contact your supervisor for further instructions. You explain the reasons to these patients because you are taking medication at incorrect time could lead to potentially having too high or too low of a dose or medication in the body. You record and report any problem about the medication in questions to the supervisor. Then again, checking the right route, which is the final right out of the five rights of medication. The route of medication means that the method by which the patient will take in the medication. And routes for taking medications can include the mouth, the ear, the eye, the rectum, inhalation, and even vagina. So wash your hands, read the container label on the medication bottle, check the route for taking the medication listed on the bottle against the route specified in the care plan. If they are the same, of course, proceed and hand the bottle to the patient or assist with medication administration as trained and ordered in the care plan. But if they are not the same, then you stop, do not proceed further. Contact a supervisor for further instructions, and you can explain the reason to the patient because it is important to what take the medications the appropriate way. Record and report any problems about the medications in question to the supervisor. So this has come to the end of today's lecture module 14C, where we talk about assisting with self-administration of an medication. And the key thing we learned is home health aides can assist with the administration of medication, but personal care aides cannot. And we made mention of the five rights of medication, which are the right patient, and we talked about how to check for the right patient. Then we have the right drug, that's the right medication. Then we also talked about the right dosage, the right dose. Then we talked about how to check for the right dose. Then we talked about the right time. And finally, we talked about the right route. So with this, we have come to the end of 14C. Thanks for your time and your cooperation. Thanks for listening as well. Have a wonderful day.